So we're just going to make a tiny little cut to help the baby out, if that's okay. You might have heard this or seen this somewhere, and it's called an episiotomy. It might just be this big, but they're cutting in a part that no one would ever voluntarily want to be cut. So let's get real about what an episiotomy is, when it is done, and when it is necessary, because there's still a lot of misinformation out there. In the very simple sense, is a cut made into the perineum when a baby is born to open up the space and allow a bigger space for the baby to come out. So generally it would be cut not down between the vagina and the anus, so that area, it's called the perineum. You can't cut lateral into the legs. It's at an angle, like 45-degree angle. Why is it cut? So the common belief years ago was that all first-time moms needed to have an episiotomy because they've never given birth before. The opening is too small. We cut it, we let the baby come out, we suture it up, Bob's your uncle, everybody is happy. Except that it is very unnecessary, it is scarring, it is painful, and it is not always needed. So why is it needed? There are only really 2 instances where an episiotomy is cut. 3 if you want to be very technical, but I'm going to get to that. So the first one, which is a real one, is if the baby is in distress and mom is pushing and she's got a very tight ring, because if it is the first baby, it might also be second or third babies, the opening of the vagina might be tight. It needs time to relax. And if this baby is in severe distress and we need to get this baby out as soon as possible, that is an indication to cut the opening to make it bigger and allow that baby to come out quicker so that we can resuscitate the baby. But we cannot cut if the baby is still high up in the birth canal. If we talk about cutting an episiotomy, this baby needs to be on the mother's perineum. Head on perineum means, remember now I said perineum is the area between the vagina and the anus. So head on perineum, I need to be able to see this head ready to come out. And cutting an episiotomy is literally saving maybe 5 minutes of pushing time, because this head is going to come out, but maybe it's a big baby, maybe mom is tired, she's pushing, and we need maybe 5 or 10 minutes and this baby will be out. But the baby's distress is so severe that we rather cut, and it's easier for the baby then to come out. That is a legit reason. The second one is if we have to do an instrumental delivery. So a forceps delivery or a vacuum delivery where you have to put instruments into the vagina. It helps if the opening is bigger so that you don't damage the tissue and cause multiple tears on other sides. It is not always necessary, especially if it's a second or third time mom. The elasticity of the vagina is a little bit more, so it is easier to get something in. But in that case, an episiotomy is warranted to cause or to prevent further damage to the rest of the perineum or the vagina. The last one is sometimes used as the most obvious one, which is why I'm careful to say, but it is to prevent severe tearing. Now, maybe you see why I'm saying people use it haphazardly. Oh, you know what, you're going to tear like really badly, so I'm going to cut an episiotomy. That is not really the case, because that's why we will cut then for everybody to prevent tearing. When we talk about severe tearing, there are certain signs that you can see this mother is starting to tear. And the one thing what we want to prevent is a tear right down the perineum from the vagina to the anus. We grade it. First and second degree tears is just through the first couple of layers of the vaginal wall or the mucus. Third or fourth degree layers goes all the way down, and it includes the sphincter of the anus, which means the sphincter is what keeps stools in if you don't want to go to the loo, and that relaxes when you do go to the loo for number 2. And damage to those structures can have long-lasting implications. If we can see, and sometimes we already know that it's a big baby, we can perhaps see that there's other indications. A doctor might preempt and say we're going to cut. It's not necessarily wrong. You can refuse, but you can never guarantee that a mother will not tear. You can just try and avoid it. But what is very often used is we can see when this baby is crowning. So again, head on perineum. When this baby is crowning, the ring of fire that you might have heard about, it is actually the skin, it turns as thin, or it becomes as thin as this part between your fingers. and it turns almost completely white because it's stretched to its maximum. And you can still tear. You can maybe have a small tear, but if we see that the skin between the vagina and the anus starts becoming all white, and you can see the skin fibers starting to tear loose, and this baby is not out yet, it's just the top of the head, there is a chance that once the head comes out completely, those fibers might tear completely and it can go straight down. In those instances, it's very subjective. Everybody will have probably a different opinion, but you can't see it. You're busy pushing. But in those instances, the doctor or the midwife might say, I think we might end up with a bad tear. So if I make a cut to the side, then the tear will follow the path of least resistance. There's already a cut. So if you are going to tear, rather tear that way than tear down. Here, I just need to suture muscles and skin down. We deal with extra structures that can cause long-lasting damage. And it doesn't need to be a big tear. If you think cutting, it doesn't mean I take a scissor and I cut the entire length of the blade. Sometimes it's literally a little nick like this, just to break the tension. So if you are tearing, it goes to the side instead of down. Or sometimes it's a little bit, if I say the cuts, it's usually around 1 to 4 centimeters long cuts. It's not massive. It can be longer than that and can be smaller than that. But that is the episiotomy. So while you are here, I have another video that you might be interested in right here. The thing is, with the healing, if you tear, which is why episiotomy started becoming like outdated or not encouraged, if it looked like a mother was tearing, to rather let her tear, because